Today, I want to continue our discussion about MALS, but I want to dive a little bit deeper and talk about why it's paramount not just to know about the vasculature associated with MALS, but to have a complete understanding of the surrounding organs that are involved with the GI tract.
So the other day, we talked about all the different signs and symptoms of MALS. There are many different conditions that can mimic those exact signs and symptoms, which is why it's so important to go to somebody who has a complete understanding of the foregut physiology and anatomy. So what are the different diseases? So diseases of the esophagus include gastroesophageal reflux disease, GERD, which we talked about in the past, achalasia. The stomach diseases include peptic ulcer disease, gastritis, gastroparesis, or delayed gastric emptying. Small intestinal disorders include things like SMA syndrome or duodenal ulcers. Finally, gallbladder. So patients with gallstones or biliary dyskinesia can have a lot of the same signs and symptoms as patients with MALS. So how do we differentiate between MALS and all these other conditions associated with the GI tract? First of all, every patient has their own story. So depending on each patient's signs and symptoms, we'll undergo a number of tests on our comprehensive MALS checklist. Starting with the esophagus, we can do tests like esophageal manometry, endoscopy, pH studies. For the stomach, we also do an endoscopy, but more specifically a gastric emptying scan to see how the stomach functions. The gallbladder, we typically would get an abdominal ultrasound to look for stones, or a HIDA scan to see how the gallbladder empties. For the small intestine, we get an upper GI with a small bowel follow-through to look for things like SMA syndrome. Now, most importantly, the tests that we do specifically for MALS include, number one, a CAT scan or a CT scan of the abdomen and pelvis. We do a CT angio of the abdomen and pelvis with inspiration and expiration. Now, the hallmark study for MALS is a dynamic duplex ultrasound with inspiration and expiration. That means that the technician is going to check the velocity of the celiac artery while you breathe in and breathe out. As you breathe out, the median arcuate ligament tightens, which means the velocity should go up. We also sometimes will get what's called a celiac nerve block to see if there's a component of neurogenic MALS. So with a combination of all these studies, we can then better understand, number one, what's going on, and number two, how to treat each patient individually. So as you can see, there's a lot of different conditions associated with this one area of your abdomen that can mimic MALS, which is why I think it's very important to go to a surgeon or a doctor who, number one, knows how to diagnose all these different conditions and can also treat all these different conditions in addition to being able to treat MALS.